A Morton's neuroma is basically a pinched nerve in the foot. As the nerve gets pinched, it gets swollen. So the swollen pinched nerve, which creates pain, burning, and numbness, is what we refer to as a neuroma. Now, it was described many years ago by a Dr. Morton, hence the name a Morton's neuroma, which is the common term that we use. Usually, if the neuroma goes untreated, it will not go away on its own. Oftentimes, it can cause some permanent damage to the nerve itself. The surgical treatment option is usually to remove the nerve. It sounds like a major surgery, but patients often do very well with removing the nerve. Now, all surgeries are not without risk. Other surgeries have been done, such as trying to release a ligament that irritates the nerve and will allow more room for the nerve. That's sometimes undertaken, but it's not too common. Most of the time the nerve is removed. There are other treatments besides surgery where doctors are trying to inject alcohol, or what we call an alcohol sclerosing injection around the nerve. These are injections that are done in the office to try and relieve symptoms without actually having to do the surgery. A candidate for surgery on a Morton's neuroma would be somebody who has failed a conservative course of action by their doctor. Those type of treatments might be oral anti-inflammatory medications, cortisone or steroid injections, orthotic inserts, which are arch supports for their shoes, different types of shoes, sometimes a modification in their activities or their exercises. So several attempts are made to resolve a patient's symptoms before surgery is undertaken or suggested. The recovery time of removing a neuroma surgically usually is about 6 to 8 weeks. That's because there's usually a significant amount of swelling after any foot surgery, so it's going to limit them. Now, they're only going to be home for a day or two just with their foot up, and they can become more mobile just after a few days, but it will definitely limit their activities such as exercise and certain types of shoes, more dress shoes. It's going to limit those for a couple of months because the foot will be swollen.